Despite trying various strategies including social distancing, quarantine, maintaining hand hygiene, masks, etc., the disease, which seems to be highly contagious, has proven to be difficult to contain and control. Keeping this in mind, Vishwa Yuvak Kendra organized this webinar to discuss the COVID-19 vaccination and the myths and challenges faced during the vaccination process.
First of all, I would like to welcome wholeheartedly to all our speakers, Dr. Neelu Srivastav ma'am and Dr. Dipanjan Sujit Rai sir, for accepting our invitation to be our resource person for today's webinar. Thank you so much, sir. Thank you so much, ma'am. Why we come up with this idea? Why do mass mobilization and mass awareness on COVID-19 vaccination drive. So, as you all are aware that the Health Ministry of India has currently authorized two vaccines, that is Covishield and Covaxin, to be administered to about 3 crore frontline workers in phase 1 of the immunization drive in the country, which was launched on back 16 January 2021. Till now, nearly 20 lakh people from the frontline workers, if we say the medical section, were vaccinated uh, in the very first phase. While the government has launched an ambitious drive to vaccinate the population against the deadly virus, many people are still worried about the same. So many questions among the masses, among the citizens, are muggling up their mind. But this is not the end. In this task, NGOs and especially our young brigade of our nation can play a very supporting role in making people aware, in making masses aware of the benefits of the vaccination, the importance of getting vaccinated. Considering the potential of our young brigade, we are we have gathered together to discuss about the vaccination process, the need to sensitize the masses. For this purpose, Vishwa Yuvak Kendra and Sri Akilandeshwari College has collaborated together to, to take it forward, to take it ahead amongst the masses.
We all know so much about vaccines and vaccination and immunization. So I think I better start directly from COVID-19 vaccination drive. Started in our country this January from 16 after the regulatory bodies have given a clearance. And till 26 January, we have vaccinated more than 20 lakhs beneficiaries, and first dose is already given to them. The DCGI have approved our vaccines. We have two vaccines. So they have approved our vaccine after rigorous Food and Drug Administration process, meeting the safety standards, and you will be happy to know that in the first phase, 70.4% efficacy was there in India. And in the second and third phase, it was comparable to the overseas and international clinical studies. So after this rigorous process and approval, then we have started this vaccine drive. In this process, 2 doses will be given to the beneficiaries 4 weeks apart. And as we all know that we have two types of vaccine with us. We have two types of vaccine, Covishield and Covaxin. And these vaccines are stored at 2 to 8 degrees centigrade. Being the largest immunization program with us, it is not difficult for us to maintain this cold chain. So it is the vaccine is stored at a particular temperature, and that is maintained. And Covishield and Covaxin are the two vaccines. Covishield is by the Serum Institute and Covaxin is by Bharat Biotech. Now we would like to know what are the do's and the don'ts of the uh, program. It has been rolled out in such a way that all beneficiary will be covered in a given time, because all the beneficiary cannot be covered in one go. So they have maintained the degrees considering their health status, their age, their work. So in the first phase, all the frontline health workers, all the frontline workers in the society, and they will be vaccinated, because they are the one who are very prone to get the illness, and they are the one who can spread the illness from one patient to another, from hospital to homes. So it is very important to vaccinate them first to stop the spread of disease. Now, how, where, and when? This is the question. How do we immunize all the beneficiaries? How means all the beneficiaries should register themselves with the government on the given helpline. You all can take out from Google or everywhere it is given which helpline. You have to register with the government, and they will inform you when your turn comes by SMS, and they will keep you informing that this is your place of immunization, this is your time of immunization, you have to be there on a given time and day. Now, the question is, who is eligible to receive the COVID-19 vaccine? In fact, all the persons above 18 years of age, all the adults above 18 years of age are eligible for this vaccination. There are not many trials in children, so we have ruled out children for now. Later, depending on the researches, we'll see whether the children should be inoculated or not. Who are temporarily not eligible means who, for the time being, they are not giving the vaccination, and they'll be given this inoculation after a certain period. So in this, those who have active symptoms of COVID disease, for simple reason that they come to the vaccination site and they can spread the infection. Secondly, they already are in the phase of developing antibodies, and we have to wait for at least 14 days after the symptoms subside, and then we can give them the COVID vaccine. We should give them the COVID vaccine actually. Who are not eligible to be administered are pregnant and lactating women, because safety is not ensured in pregnancy and lactation. Or if someone is allergic to any component or the COVID-19 vaccine, they should not be given this, because severe anaphylactic reaction will happen if any person allergic to it is given. Anyone who is immediate or delayed onset of allergic problem, these injections are not given. And the person who is already taken some vaccine in the last 14 days is not given for the time. Now we want to know what are the adverse reaction of the Covishield. In fact, Covishield and Covaxin, they have the same adverse reaction, like injection tenderness, the pain of the site of injection, swelling at the site of injection, some headache, nausea. These symptoms are very mild and can be taken care of at the vaccination center only. Very rarely, there are some serious side effects which can be managed by hospitalization, or there are arrangements there at the vaccination centers also. So I don't think there is any worry about the side effects or the adverse effect of the vaccine.
There's so much of myths and misconceptions going around. People get confused. Should I take? In fact, healthcare workers have been refusing vaccines. So, when it starts with that, then people start feeling, oh, there must be something wrong. There's nothing wrong. Everything is good. We are trying our best, but it doesn't work that way, I suppose. So, here we are to provide, and the youth of the country needs to come up and be the spokesperson to help us, help the nation contain the COVID 19 and get us back to where we were. When COVID 19 happens, it is not only a health issue, it's a major financial, it's a major economic, it's a major social disruption issue. So let's start thinking, and the youth of the country are the major force who would make it happen and roll the wheels of the economy back to square one. And that can be done through proper, correct, and appropriate knowledge, through the use of vaccines and other containment measures which we are using for COVID-19, so that they don't, the COVID doesn't disrupt or kill or do. We have done well as far as India is concerned. Our death rates are among the lowest in the whole world. If you look at how the United States is faring, or other countries like Brazil, the Russian Federation, the European Union, etc., you would see the statistics. I don't need to go there. I would just impinge upon a couple of more things. I'll just expand upon few things which Dr. Srivastav has mentioned. And going back to how we started developing the COVID-19 vaccine, I have myself been involved with the major advocacy, as well as certain of the technicalities. I myself are one of the vaccine experts from CDC, so that's how I was involved in many of these. This is really an extraordinary situation and brought in extraordinary efforts. So it's been good that we could do the reverse engineering quickly. The trial started in April 2020, as you can see, which has never been with any other disease that we know till date. And why this could happen? Perhaps because of the kind of technology which we have today. We have so much of simulation softwares, and computers are, of course, the major stay of why we could get everything up and running without compromising the safety and the efficacy aspects of any vaccine. So we'll come to the myths and misconceptions to give you more details. But putting the things and putting the spoke to the wheel, I just want to make sure that it's the first time, and when everybody came together, because their humanity realized that it's not a very pleasurable experience. We need to come together to fight and take care of this unprecedented catastrophe or a pandemic of COVID-19 which came from. So trial started with this. Indian vaccine scenario, if you look at it, only two vaccines have been rolled out, and three are currently doing the phase trials, that is phase 3 ongoing for two of them, and phase 1 and phase 2 going for one of the other ones. The purpose is efficacy rates are very good. It's more than 70% for Covishield. The Covaxin and other data has not been rolled out. So it's available, but it's not public knowledge. So that's the reason I haven't put it out here. You will find this on the website of the Ministry of Health and Family Welfare, and also on the ICMR. So all of these are available there. And in the second column, which you can see here, if you look at it, the type, which is different types of vaccines. Uh, let's not go to the nuances of what vaccines are, but in thumb rule, same thing what Dr. Srivastav just mentioned. Both the vaccines, Covishield and Covaxin, have very good efficacy. More than 70% is very, very good. We don't really have to worry. And also the side effects are relatively much, much lower, hardly anything. In fact, if you compare with the existing vaccines like measles vaccines, or even polio vaccines, or you can with other influenza vaccines, it has got similar efficacy, side effects. So it's definitely not going to be real out of the blue or something of that nature. But good thing is, one of the vaccines, I want to highlight only one thing about Covaxin, which is the number 2 you see on the screen here. It is the vaccine which has been indigenously completely developed. All these, this Covaxin is the one which has been really developed indigenously, from the research to the final one. So it's a good thing for all of us. It's good because Covishield and others, there's of course AstraZeneca with Oxford and others did. The Zydus Cadila vaccine is also from there. Sputnik is of course from the Russian one, and biologically is novel COVID vaccine is also a part of the indigenous vaccine development. So it's very good as far as the R&D is concerned. Please note that India is one of the countries which has got the best vaccine production that is, Serum Institute, Biologically, and you have the Bharat Biotech, etc., etc. Many of them are there. So world's major vaccines are all produced in India. So whoever develops it doesn't make a difference. But when you need to produce it in a mass scale and also with the quality which is required, India is the country to go for. So that's something to be really proud of. So that's how I think we have not only developed the vaccines for us, we have also donated vaccines to all our neighboring countries and the countries which are not in a position to really buy out. So that's a very good gesture from the government of India as of now. Now the vaccines are coming out, so we should be much more clearer that okay, what we are taking, if we are taking it, is it safe, it is not going to do anything, because unfortunately the myths, misconceptions, and rumors have faster way of putting through, going through than the real channels. If you look at the correct information, it is very difficult to find on the internet even today, and you will find more myths and misconceptions because it sells better. So myths and misconceptions must be seen in the backdrop of a scientific evidence and the concept and logicality.
Thank you so much to renowned resource persons. I must say, more than resource persons, people who are sharing with us the right information which is needed. We are living in this time of digital age. Where fake news and fake stories are passed through the digital medium. So, but these are people like Dr. Dipanjan and Dr. Neelu have spent years and years of their life studying medical profession, and knowing what is right and wrong. So it is very much important that we listen to uh, their their ideas, their experience, rather than looking at through Facebook or through WhatsApp or through other mediums which are not verified. So that is very important. So we thank both our resource persons once again, Dr. Neelu and Dr. Dipanjan ji, for taking out time for this very important COVID vaccination.
Thanks for watching. For more updates, please subscribe to our official YouTube channel and follow us here.